Hi, and welcome to Wow Talk. I'm Donna Cappuccitti, a thriving cancer survivor.
And I'm her naturopathic doctor, Darlene Gustin. We're here to encourage, educate, and empower you on your journey to optimum wellness.
Welcome to the new year.
Happy New Year!
Happy New Year. And I like what you were mentioning earlier, what would be a really great topic today. So why don't you tell us?
Dealing with life's unexpected. I mean, most of the time we talk about chronic health conditions, which is what naturopaths usually focus on.
Yeah.
I mean, we're certainly not the person you see in an emergency room, but a lot of the times people have appointments after some type of an injury or an accident. And there's definitely a lot of naturopathic approaches that can help you recover.
Yes, exactly. So, well, I was sharing a story with you just before we started recording about my wonderful niece who is she is a yoga guru. We should have her on one day to talk about it all. She's Dedica on Instagram. But anyway, she had a horrific accident in Mexico. I was telling you about that, where she broke her leg in a few places, and she needed 3 surgeries, and now she is recovering. And that's the Reader's Digest version of this story. But anyway, that then prompted us to think about how we all need resilience.
Absolutely. And how to deal with acute health problems.
Yeah.
Because it's not just surgery.
No, there's a lot of mental health that has to go along with it. And so much of it is post-surgery too.
Of course.
You know, and so anyway, why don't you share some things?
Sure.
First thing that comes to my mind as kind of not a remedy, I don't know what you call it, but arnica. I don't know.
Of course.
I'm thinking arnica.
Oh, arnica's great.
Please tell us a little bit about that.
Arnica is mountain daisy, and the history of arnica in herbal medicine is that the way it was discovered was when the mountain goats would slip and fall on the mountains. They would eat this flower, get up and walk away. So it became of interest to human use, but humans can't consume arnica orally unless it's topical or diluted homeopathically.
Yes.
And in those locations where traditional medical doctors work alongside with naturopathic doctors, the first thing that impresses them is the use of arnica. And it's a first aid remedy for injuries, usually physical injuries, but depending on the potency of the homeopathic dose, it would also help with the emotional part of it, because there can be some trauma.
Yes. And I'm sure there's a lot of trauma, because it's not just the pain. We'll talk about pain management as well. But the thought of, oh my goodness, I am the most mobile and flexible person ever. And now I can't even move. I have to stay in a bed. I have to be weighted on hand and foot. I cannot even toilet myself at this point.
For sure.
It just has to take its toll so deep on so many levels. So I didn't realize that arnica was good for that too. I actually took some form of it prior to and after I went through my pregnancies.
Absolutely.
Yes.
Me too.
Yes.
The birth, the labor itself.
Exactly. Yes. And I have to say, I think each time I recovered quite quickly.
My favorite arnica story was once my son, he was a toddler, and we were having a big birthday party, maybe second or third birthday. I have a house full of people, and I had this fireplace with exposed brick ledge in front of the fireplace.
Oh, I know where this is going.
Yeah, of course. So busy, typical 2-3-year-old boy running, and of course does a full face plant on the ledge of the brick on the fireplace. And this immediate sausage pops out of his forehead. And I looked at him in shock. I've got a house full of people. My brother is a firefighter. He's like looking, we're all just staring at each other. His wife works in a hospital, and we're just kind of looking at each other in slow motion. And the only thing I could think of is arnica. So I went running for the arnica, gave him arnica, and you could see the swelling was starting to drop down into his eye, and his eye was starting to go blue. But I'll never forget that sausage that popped out of his forehead. It was like several inches long.
Oh,
it was truly like a ballpark sausage.
I've seen those before. It's so scary. And did it break the skin?
No.
Thank goodness. Oh.
But I gave him arnica. And no word of a lie. In 30 minutes, the only thing you could see was a little blue under his eye.
Oh my goodness.
It was incredible. So arnica can help with bruising, swelling. I also give it to people when they're having surgery, when we know there's a surgery coming up, because it can help people with how they react if they don't have a good history with how they react to anesthetics. It can help with that. And as a homeopathic remedy, there's generally no contraindications to prescription medications. But it's always advised that everybody knows everything you're doing.
Yes.
But my patients have had great success with surgery, and the recovery that was expected and communicated to them by the surgeons, the patient experienced 20 to 30% of what they thought. So they get to go home sooner. They needed less meds. There was less bruising, less bleeding, less swelling. So arnica is amazing. But going back to your poor cousin, it's just devastating. This young, fit yoga instructor suddenly, slips off the table and has this devastating injury.
Devastating.
And so in that case, like sometimes I don't get to talk to the person so soon after the injury. I might meet them months or years later and they go, I never recovered.
Exactly.
And usually what I look for is, do you have enough zinc? Do you eat enough protein? Are you taking the extra calcium at this moment because you're knitting the bone back together?
Yes.
So when you're dealing with an injury, there are certain nutritional needs that are increased to help with the healing. Probably also some vitamin C. And there's a huge emotional component. This poor, vital, physically active woman is now bedridden. And that's, really going to play with a person's emotional health. And a lot of people have a health-related post-traumatic stress disorder, PTSD.
Yes.
Even my cancer patients have PTSD. So, the good thing is that injuries like that have the ability for a full recovery. And the more fit you are, the better and faster the quality of that recovery.
That's what I believe. Yes. And she is so fit and so, so careful with her nutrition and just lives a very clean, healthy life. So I think that this will be a speedy recovery, as speedy as it can be. And also the surgeon that did perform the surgeries was very, very good. And it looks like the before and afters look so good. So she's on the right track. So it's not like, oh my goodness, they made a mistake. Now they have to go in and do it again or something. So that part. Now, what about pain management? Is there something natural that people could take to help with the pain?
I personally haven't needed to do much more than arnica.
Seriously?
Yeah, but there's more. Like, you can use essential oils, but not on broken skin, not orally. You can use anti-inflammatories like turmeric, curcumin, bromelain, which is pineapple, enzymes. They're very anti-inflammatory. Even just cold water. Like, it doesn't have to be a supplement or a drug. Good old cold water or meditation, breathing, just these simple things. They work as good as they did 1,000 years ago when they didn't have supplements and drugs, right?
Drugs. Yes, exactly.
So a cold water compress does wonders for inflammation.
Okay, that's good to know. And speaking of bones, one thing that we may want to touch on, which is kind of taking this a little bit as a right-hand turn here with our conversation, but what about bone density?
Well, it's not something that you feel.
Okay.
So sometimes you're healthy with amazing strong bones and you just fell on the wrong angle.
Yeah.
And it has nothing to do with your bone density. But people who didn't fall so bad and hard or keep breaking bones with relatively small reasons to, of course, you should find out if your bone density is what it should be, because you can't feel if your bones are weak or strong. And when the older ladies have broken hips, they don't trip and therefore the hip breaks. The theory is more the other way around.
Yeah. Exactly.
You fell because the hip broke first.
Isn't that something? Yeah, I know.
Yeah.
And I believe that for sure. So let's talk about what a bone density test is.
Mhm.
I've had several,
Mhm.
and it's kind of like an X-ray kind of thing, is it
Mhm.
not?
Yeah. Yeah.
Really. Like you go on that's the room you go into, and
Mhm.
and what does it measure exactly?
It's measuring how many grams of calcium there is per square centimeter. And
Wow.
yeah, but the one thing that the bone density tests don't do is they don't measure if the texture of the bone is what it should be. But I've
Oh,
just recently heard that there is a new private test available that has something to say about the quality of the bone, not just how much calcium is there. Yeah.
okay. So how would one figure that out? Or is it just,
They wouldn't know if
you
it
would
just
never know?
going through the mainstream medicine, you would just really be taking meds or supplements or both, and you'd be getting a bone density test 1 to 3 years later, maybe 5 years later.
Mm-hmm.
So you need to choose well at the beginning of that journey, because you're not going to get the feedback for 1 to 5 years.
Okay. So what are the things that are very positive that are helpful to maintain good bone density? And can you build it up, or are you stuck with whatever you have? Like if you've lost so much, can you just maintain where you are? Or are there things we can take or do that will increase our bone density?
I've definitely seen patients increase their bone density,
Okay.
but bone density goes further back than that. You're establishing bone density at a younger age, like teenage to early 20 time of life. Your physical activity level and calcium intake at that time sets the stage. And normally bone density is not tested until after menopause, so we don't have a reference point.
Okay.
So we don't know, did you fill up the tank 100% when you were 20 and then withdraw at a later age, and instead of, maybe if you started with 80% bone density but you didn't look until after menopause and now it's 60% bone density, did you drop from 80 or did you drop from 100%? So we don't really know, because those
Okay.
reference points are not done as a routine. But there's a new calcium that came on the market in Canada right in the middle of COVID. And normally I have my products that are known and trusted for decades, and I'm a really hard sell
Yeah. Okay.
to a new
because
product.
you know what works.
Yeah, I'm not
so
changing
why
what
change
works.
it? Yeah, exactly.
Yeah. And but because it was COVID and I wasn't allowed to work at that point, I had time to read emails. And the only reason I read this promotional email was because I recognized one of the people doing the research.
Okay.
And I thought, oh, if he's there, this is going to be something good. I'm going to read this whole email. So there's this new kind of calcium, and the research on this calcium was showing that all the people in the study had consistent increases of bone density all 7 years in a row in the study on this new calcium that comes from algae.
Oh.
So, but calcium bone density, it's not just about calcium. It's a very multifactorial conversation. So when someone comes in for a problem with their bones, the first thing I do is ask them to test if they're acidic,
Okay.
because
Yes.
poor little bones in an acidic body are just going to melt.
Yes. Yeah.
And calcium doesn't work alone. Calcium's best friend is magnesium, and then
Yes.
vitamin D.
Yes.
But nobody ever talks about boron and strontium and manganese and copper.
No.
So going back to that study, they included strontium.
Strontium.
Yeah, nobody ever talks about
No.
strontium.
No.
Exactly.
So, and is that something you can take? Or is that
It's
in
a
something
mineral.
else? It's
Yeah,
a mineral.
It's
Okay.
a mineral. I mean, the odd time you'll see it hiding in the background in a very thorough multivitamin, but you can buy it in a bottle all by itself. But when I talked to the reps at this company, I said, okay, so you studied these people for 7 years. This stuff looks really good. 7 years in a row, that's pretty good. And show me the dose of calcium. What's so special about this calcium? And part of the protocol was that they gave everybody strontium. And they are on the west coast of Canada. And I said to them, I go, so does anybody actually measure the strontium? Because I do. I test everybody's hair mineral analysis.
Yes.
So I know a lot about what all the minerals are doing. as a package, as a team. So some people really just need calcium, calcium D and magnesium. Other people need a whole bunch of extra minerals in addition. But in the study, they just gave everybody strontium. And so they were really interested in the fact that I measure people's hair for minerals. And so I kind of take their research and personalize it. I'm not going to give the same recipe to every one of my patients because I know a lot more detail on each of them. But strontium's a great thing to read about.
Okay. Strontium.
Yeah, it helps.
New word.
Yeah, it helps the bone draw the calcium towards itself.
Okay. And that makes sense because you can put the calcium, all the calcium you want in your body, but if it's not being drawn to where it needs to go.
And then it has to stay there.
Yes.
So if it's after menopause, when you're living in a body that has less hormones, your ability to retain the calcium is what happened. So it's not like you need more calcium because you are now postmenopausal. No, it's the other way around. Because you're postmenopausal, you're less capable of retaining the calcium that was there before.
All right.
So it's not just about blindly taking calcium. It's about also searching for the root cause for the leakage of calcium. I call it leaky calcium.
Leaky calcium. Okay. Well, that's good. Is there anything else we didn't touch on?
No, I think it was a great topic.
I think so too. I think we covered
I had fun.
it all. Yeah. But resilience too. Back to that word.
Yeah.
Yeah. Bouncing back. Being resilient to these things that happen.
Yeah.
And taking the time and the beat, taking a beat and realizing this is not the end of the world.
No.
And that there is a way to combat and to come back no matter what comes our way and to look at the bright side. That is one thing that my sister, because it is my niece actually who had the accident, my sister kept saying, it's a leg and thank goodness the leg will heal and she will be able to walk again.
Yes.
There's a lot of other more serious injuries that might have happened that particular day. So if we look at that, once again, look at the bright side.
It's fixable.
It's fixable.
I say that to my patients so often. They come and some patients, everywhere I look, I see a problem. Oh, you're acidic. You're missing all the minerals. You're burned out. Look at all the parasites in your blood. Just like everywhere I look, I see that things are not where they should be. I go, okay, this is a mess, but it's fixable, right? And with resilience, to a naturopath, when we hear the word resilience, we think about the adrenal glands, the stress glands. So if I was to share my top 3 tips for resilience, it would be the same top 3 tips for stress or adrenal function. And so I want to end by sharing these top 3 tips that are so good. They're so simple and practical. So the best thing I've seen in over 30 years as a naturopath, number 1 thing is rest.
Yes.
So whether it's stress or trauma or injury, you need extra rest. You heal when you're sleeping, physically and emotionally. So that's number 1. Number 2 is this is when you need extra protein.
Yes. Yes.
And many people don't get enough in the first place. So extra protein. Protein is a macronutrient, comes from meat, fish, eggs, cheese, beans, lentils, and that's what our body physically is made of. So to heal, you need extra tools from which to knit things back together. So number 2 is extra protein. And number 3 is change your thinking.
Change your thinking, yes.
Mindset, for sure. So just kind of reframe it in the course of a lifetime and say, okay, that was a nasty break. She broke her leg really bad in a foreign country, but they did a great job. It's fixable. She will be Miss Yoga all over again.
That's right. She will be. Anyway, well, thank you so much for listening. And thank you for all your insight, Dr. Gustin.
Thank you, Donna.
Always amaze me. And if you have any questions, please send them our way. And
Happy New Year.
Happy New Year. Be resilient.
Yes.
Okay. Bye.
Bye.